Welcome. It's great to be back at the full pavilion here. Once again, it's the third event of our Open Mic Next in Health series. And I'm really excited to be back with yet another great, fantastic set of expert speakers discussing their views on the digital transformation of health systems tonight. I am your host. My name is Rael. I work for Switzerland Innovation Park, Basel area. If you do not know us yet, we operate office space here on the Novartis campus focusing on digital health and health tech ventures. This is a co-organized event, actually, where here's my wonderful colleague Anka from Day One Healthcare Innovation, the Healthcare Innovation Initiative from Basel area. Before I hand over to Anka to say a few words on Day One, I'd just like to mention a few things. Tonight we will use again Mentimeter for everyone on site, but also for all the people joining online. Welcome to the online audience as well. You will see the QR code on the screens and also in the chat on Mentimeter. So please interact, send in your questions, and it will be taken up during the Q&A session later on. But now, Anka, over to you.
Thank you, Rachel, very much. Warm welcome to everyone here with us on site in Basel at the Novartis Pavilion, as well as the ones who joined us online. I'm Anka Del Rio. I'm representing Day One Healthcare Innovation, which is the health tech and, as the word says, healthcare innovation arm of Basel Area Business and Innovation. It is my pleasure to share the stage with Rachel here today and to get you all in a deeper dive of today's topic, which was not only so amazingly embraced by all of you, but also something very, very relevant for us to discuss, and why not do more about it. So what we all know so far working in this sector, regardless which actors are we representing, is that health systems are quite complex and multifaceted. The global megatrends, on the other hand, have accelerated the pace of the digital disruption and digital transformation of healthcare. But what they actually did, it was also showing to the different kind of stakeholders involved in the transformation the shortcomings when it comes to the adoption of technology, to the understanding of the data, and looking towards what the next step is in the digital transformation of healthcare. And today we gathered here to, as I said, take actually a deeper dive into these topics and see what actually means a data-driven approach to improve the health systems we are all a part of, not only as professionals, but most importantly, personally, as patients, as citizens, when we talk about a citizen-centric approach when it comes to data and when it comes to our health. What are the best practices in digitalizing operations? And today, for this reason, we're going to hear from a variety of stakeholders representing not only the private sector, but also the startup sector, the startup sector, and of course the public sector and regulators. And without any further ado, I would like to introduce to you on stage, coming all the way from Copenhagen, our keynote speaker, Clayton Hamilton, representing the WHO Europe.
Anka, thank you very much, Rachel. Good afternoon, ladies and gentlemen. It's a pleasure to be here with you today in Basel, and a warm welcome also to all of those people joining us online. I'd like to start by a big thanks to Switzerland Innovation Park Basel area and to Day One Healthcare Innovation for taking the time and the effort and the money to bring us all together here today. So, as you have no doubt noted, we're here today to take a deep dive look into a topic: no data, no health. No data, no health. When I first started looking at this topic a couple of weeks ago, I found it actually rather foreboding. In some ways, it almost scared me. It's a statement that somewhat is confronting. And in another way, it's actually somewhat intriguing and entices a certain sense of curiosity. What do we mean by no data, no health? What role does data have now and in the future in terms of determining health? So to frame today's discussion, I decided to use this title and interpret it in 4 different lenses to help us think together about the actions we can and need to take to better understand and leverage data for health. The first of these lenses is something that many of you in different roles and different capacities work with, and that is national data ecosystems and the governance of health data. Really, when we say a statement like no data, no health, through a system lens, what we're actually saying, or what we're actually passively acknowledging, is the transition of data that was once simply used to accompany the delivery of care to it becoming a valuable strategic asset that's now used to drive prediction, diagnosis, solution discovery, and access to care. Said in other terms, timely access to quality health data has become, or will become, a key determinant of good health and well-being. Now that's quite a transition if we just stop for a moment and think about it. Something that was regarded as a utility, as an artifact, is now front and centre as the biggest strategic value to health now and in the future. But the reality of European health systems are still somewhat far from enabling us to leverage the full value of data for health. In my role in WHO, I sit in the regional office in Copenhagen in Denmark, and I work with 53 countries who individually are battling to develop digital, or to undertake programs of digital transformation and to change their data ecosystems in such a way that they will satisfy all of the multitude of demands that data is now placing upon the different health systems. However, national health information systems are really struggling. They're challenged to meet the changing demands that have arisen as data has taken on this new strategic hat, if you like to think of it like that. The needs for data use in terms of clinical care, quality control, patient safety, policy design, research and development, product design, and disease prediction are quite simply not being met by the data ecosystems which countries have in place today. While recent progress spawned by the pandemic in improving digital transformation is certainly welcome, it's not going to get us to where we need to be in terms of having data ecosystems that are fit for purpose for today or for the future. As you've probably heard the adage, no amount of iterative improvement of the candle got us to the light bulb. And that is the same in terms of data ecosystems. We need to think wildly differently in how data is produced, used, shared, and structured if we're going to reach the ideal of having data in the right place at the right time to the right individual. From a recent WHO Europe report called The Ongoing Journey to Commitment and Transformation, it's freely available on the internet, we now have 83% of the 53 countries we look at having at least a digital health strategy or policy to guide their development. And that's a huge improvement on just 5 years ago, when that figure was around about 68%. So already in a short period of time, there's been at least a greater acknowledgement of the role of digital technologies. However, when we drill down a little bit more under that data to look into specific data strategies, only 60% of those countries have a data strategy. And when we dig even further, only 35% have policies that govern the use of health data and analytics in the health systems. 35%. That's a very low figure for something that has such incredible value. And when you often read the trillions of dollars that are being invested in data and digital technologies. So you can see already now that there's a gap in understanding between where the private sector are going and how public systems are able to respond. So there is now an acute need for a better understanding of how to design and govern national ecosystems for data to ensure that all the requirements that you have, that the public systems have, that private and R&D institutions and academic institutions have, to make sure that their needs are met, to create what I call the fertile soil to allow digital solutions and driven technologies to grow, to connect, and to operate. In particular, what I believe we need to do more, and what countries are asking WHO, is to have a better description of what good looks like when it comes to data ecosystems and the governance of data. We really aren't very good at actually putting it together as a holistic picture of what countries need to do in order to actually move forward with developing the types of systems that will allow ubiquitous access to data. And I can certainly say that if we don't actually have the access to data that we need ubiquitously in the right patient at the right time or the right individual at the right time, we won't reach the paradigm of patient-centered care or citizen-centric care, as it often is termed. If we go back to our no data, no health moniker, we can also consider this through the notion of the insights that data can provide us on health and disease. And it's here that the perspectives of trust and of culture enter the picture as some of the most underrepresented and most threatening factors to undermine the potential value of data for health. There is definitely a need for better insights to data, not just more data. But I'll take that a step further. There is really a need for a data culture to be developed in health, where decision makers understand the benefits of leveraging data that's available to them for evidence-based decision making. We know this is not the case today. It's politics and media that influence the macro decisions that are made in health. So what I'm saying to you is that even in those systems where data is available, and even in those systems where that data can be turned into insight, those insights are not being used. So I think that to change this scenario, we need to invest more in data science. We need to invest more in legitimizing the role of data in producing insights for health. And we need to have literacy at the very highest level of politics so that there is a broad understanding of the role of data in actually informing decisions for health. An effective data culture also needs, in my opinion, two additional things. Mechanisms of trust that are established and recognised by the public and healthcare professionals to give them the necessary confidence to use and share health data. In every one of the discussions that I go to, the issue of trust comes up. And everyone acknowledges it. We nod our heads, we smile, we say, this is really important. But actually, we're rather poor at articulating what we mean by trust in a tangible sense. It's either somehow an ephemeral concept that lives up here, we all need to trust each other, or it's a very hard concept that's rooted in data security and images of padlocks and other very hard mechanisms. But actually, we started to think about how trust can play a role in data ecosystems by looking at an ambient trust within society, the role of the health system in garnering trust, and what an individual needs in order to be equipped sufficiently to trust the data in the digital systems that they're using. We also need greater inclusion of data sets from outside of the health sector, particularly in addressing environmental, social, and behavioural factors impacting a population's health and well-being. So the situation we have is that today a majority of data subsystems and digital health solutions are good at individual process management, but they're actually poor at producing the insights of value in the required context I mentioned previously. So again, no matter how much we discuss it, no matter how much we would like a patient-centric view, without availability of data when and where it's needed and giving control to individuals via that data to manage their health and disease conditions, it will become a dream that we never realise. To cap this off, we know that the efforts countries are putting into evaluating the impact of their investments and in data digital technologies is actually relatively poor. Only 19% of countries have any guidance on evaluating digital technologies at the national level. So 1 in 5 countries only are making any effort to see if the investments that they're making are actually producing the tangible results that we all hope that they are. Again, no data, no health. We can, of course, also interpret this statement in terms of an equity lens. Inequalities in access to and use of data will lead to real health inequalities and reduced quality of care. This will also exacerbate existing power and wealth asymmetries in health systems and ultimately result in poorer health, lower quality of life, and entrenched poverty for millions and millions of people. And this is really an important issue, and this is what keeps me awake at night. How can we avoid data inequities from arising to create these power asymmetries? More value, however, will be created and can be created through sharing of data than by making it a siloed governmental or commercial asset. We need to be able to stratify data from across different sources and across different population groups to determine those most at risk of disease. And that's where data has its greatest use. As we move also to more and more AI taking hold in health systems, open rather than closed models of data and algorithm sharing will give us mutual benefits for developers, for providers, and for patients. So open is win-win when it comes to data. But as we all know, equity itself is a multifaceted and rather difficult concept to deal with. And it has many underlying causes. To give you some indication from a digital perspective, only half of the 53 countries in our region have policies and strategy promoting digital health literacy, and less than half have digital inclusion plans, leaving disadvantaged populations further at risk of falling behind. Finally, I want to interpret no data, no health in terms of the partnerships that we need to have, not those we have today, but those that we need to have in order to achieve our collective goals of using data for better health and well-being. Novel multi-stakeholder partnership structures are needed urgently. New thinking from new stakeholders in new configurations to bring us together to address some of the most intangible and intractable problems related to digital transformation. Member states have therefore asked WHO specifically to broker a method to examine how new, novel partnerships can be created that bring together thinking across different stakeholder groups, and in particular the private sector, to provide input to solving some of the biggest challenges we do face. Our office, WHO Europe, has now created a new forum called, rather unimaginatively, the Strategic Partners Initiative for Data and Digital Health. All are welcomed to apply to this partnership. If you simply Google SPI-DDH, you'll be able to see how you can apply. There are terms of reference, and we encourage all institutions, big and small, to actually take an active engagement in this. On that note, I wanted to conclude by saying that leveraging the full value of data for health can only be achieved if we work together towards the shared goals of equitable and accessible health and well-being for all. And these are the values that are underpinned in WHO's Charter for Health and in the description of universal healthcare. Shaping of the design of future of data and digital health systems, however, is up to us, to every person in this room and every person online. And I look forward to more discussion on these perspectives I presented and other ones in the panel discussion which is to follow. Thank you very much for your time today.
Thank you so much, Clayton. This has definitely set up the stage for what's about to come and the deep dive that I promised you. Therefore, I would like to invite our moderator on stage, Peter Speyer from the Novartis Foundation. Welcome, Peter.
Thank you, Anka.
But of course, the next one in line, Anna Damota from AWS Healthcare. As I promised, we're representing all the voices that could fit onto this stage. With no further ado, Mario Bernasconi from Well. And last but not least, Regula Spüller from Hey Patient. Welcome, and we will definitely enjoy. That's all I can say. No more spoilers.
Awesome, thank you, Anka. So welcome everybody in the room and online. When I heard first about the topic being for today, no data, no health, I was immediately intrigued and very happy, and then it's great to see the excitement and the interest in this topic, and so I'm very much looking forward to the discussion today. Many thanks to Day One to make space for this topic today, and then for Clayton for a great introduction to the topic, very informative and very inspirational. We'll go through the panel really quick to give you a background on who we are and how we're thinking about this topic, and then jump into a discussion about a few of the core topics in here, and then open up for Q&A. So I personally, I think this is one of the most important, but also one of the most exciting topics that we have in the health field at the moment. You cannot manage what you can't measure, and so if you have no data, you can't really, figure out a way to improve the situation. Of course, you have to measure what's important, not just anything, but I think starting with kind of what do we want to measure, measuring it enables us to set a path to action. The perspective I'm bringing to this, I'll just sketch in kind of 3 projects I've been working on that made me intricately familiar with the topic. I used to work at the Institute for Health Metrics and Evaluation in Seattle, which runs the Global Burden of Disease study. And the Institute is trying to quantify health loss from all diseases, injuries, and risk factors in countries across the globe by age and sex. And if you think about the sheer volume of data that could be used for this, it's massive. And trying to find these data, getting access to these data, integrating and analyzing them is a heroic effort, and to this day, incredibly hard to find relevant data. So again, no data, no health. Thinking about the global perspective, there's an institute spending a lot of time and 500 people's effort on this, and they are still struggling getting all these data together. The second project was at Novartis. So before I joined the Novartis Foundation, a few months ago, I worked for Novartis, the company, and we ran a project called Data 42, where we brought together clinical trial data from across the company with clinical, genomic, proteomic, actigraphy, and other data. So this is within one company over the past 10 years, and even this was a multi-year effort with a significant team to saying, can we link these data, can we harmonize them, make them accessible internally, with a lot of discussions around data standards and the governance around these data. And then the last one is now at the Novartis Foundation, which is a nonprofit within the Novartis group, but with an own mission of improving population health and not tied to pharma or healthcare priorities, but looking at health overall, where we're aiming to measure how factors that Clayton just mentioned, from kind of the personal situation to the social determinants around you, to the health behaviors, what drives good versus bad cardiovascular outcomes, and what can we do about this? Do we know whether education or a hospital will be the better investment for a city or a country? And again, huge data challenge to find relevant data sources. So I'm very excited about the opportunities the technology offers, as Anka said in the beginning, between being able to measure with trackers to new standards to actually combine data, to cloud computing, to Gen AI and the ability to digest and use massive amounts of data. I think we have huge opportunities to accelerate access and use of data significantly. On the other hand, need to be super aware that these data are sensitive and need to be governed very carefully. We need to make sure that people that are supposed to use and act on these data actually can do so, that we have the data literacy, like Clayton called it, data culture, but also kind of a user and citizen centricity to saying, how do we actually use these data to improve health? So with that, that's my kind of view on how we're going through those topics today. I'll hand over to Anna for a few remarks and then go through the rest of the panel.
Thank you. Can you hear me? Yes.
Yes.
So I was supposed to give an elevator pitch about myself because no one is going to introduce me, so I'll do that quickly. I'm Anna. I lead the public policy team for Amazon Web Services, AWS, covering Europe, the Middle East, and Africa. I've been on this job for 5 years now, coming from the Americas team, where I used to work with health and other topics in LATAM. In my 15 years of experience working with technology, policy, my background, I'm an IP lawyer. And part of my role is translating everything that we're talking now, and I think everything we're going to discuss about data and the tech nuances of data into a language that is accessible for policymakers, politicians, regulators. It's very much day one for cloud. Thank you, day one, and Novartis for the invitation. It's really a good match. It's the early stage of journey. And I say that backed by data, right? Because we want to be also focused here on numbers. So 97% of all data in the healthcare space is still stuck in unstructured formats, right? So we're talking about an industry that is still very much operating based on fax machine. We were discussing this earlier today. it's a reality. It's an industry or a sector that is very much still dealing with paper-based, and it's not just because it's still there. Many times it's a culture of having these physical assets and very much being attached to the way that we used to keep data safe, right? We have a piece of paper that is important, it's sealed, has an importance of the sealing process, and then we put it in a drawer and we have control. And the moment that we digitalize things, we have the feeling, and this is not me saying, of course, I'm talking about the policymakers and the industry and the customers that I am talking to every day, that we kind of lose a little bit of the control. So how can we make sure that we're going this journey of digital transformation as a society? We discuss it with all the stakeholders. Clayton mentioned it very much. We need to make sure that literacy is brought to the highest level of political discussions, but it's also in every home, right? Because we are citizens, we are patients now, and every stage of our life will be a patient at some point. It's sad to say that 2 of us are going to have cancer. This is a global scary number. And if we're not a cancer patient, then we're going to be taking care of someone that is a cancer patient. So involving the citizens, their families, the beloved ones, but also those that are in the healthcare workforce. And we have expanded this, like COVID has shown the importance of mental health, the importance of all those, the nurses on the front line, psychologists, psychiatrists. So it's an entire chain of professionals that are there taking care and deciding to take care. And this takes me again to the role that we have in education. So how are we talking about our university students, about their role in this digital transformation path? Making sure that they're comfortable and then they trust technology, right? As a good thing, because technology per se it's not good or bad, right? It's what we do with it that will have an implication of how we use it. So with that in mind, I think I'm going to conclude my remarks and pass the mic to Mario. Thank you.
Okay, thank you. Yes, my name is Mario. I'm CEO from Well. Well is a Zurich-based startup founded by 6 major players in the Swiss healthcare industry. 2 insurance company, health insurance company, telemedicine provider, pharmacy chain, online pharmacy, and technology provider, and also a private Swiss hospital chain. So what we do at Well is basically we established an app 2.5 years ago. We launched it. We started with, I don't know, around 1,500 friends and family user, and the app is basically the access for each Swiss citizen to the healthcare system. It's based on 3 pillars. On one hand, you can personalize the app with your insurance card, and in the Swiss healthcare system, based on your insurance model, you get guided through the healthcare system. But you can also personalize the app based on your preferences. For instance, the family mode, if you want the services not just for you but also for your family, and so on. The second pillar of our application is basically the guidance. You don't feel well and you want to get guidance. Do I have to go to the doctor? Do I have to call the telemedicine doctor, go to the pharmacy, or are there any self-treatment opportunities? So that's kind of the symptom checker, doctor chat guides that help you to get access to the healthcare system. And on the third pillar, we connect you to digital services, to information, but also to physical services with appointment booking and so on. So that's the idea and the vision of Well. So far we have 190,000 app users, so it took a while, but now it works quite well, and therefore we are an open ecosystem, we are an open platform, so it's not just the 6 investors that can contribute and to our platform, but also other co-creation partner, technology partner, and that's how we want to help the Swiss healthcare system to to get more connected. From my point of view, it's really important that we share data, and for sharing data, it's important to creating value, and that's what we try to do to our app user, to each of you when you're Swiss residents, so that you get value out of sharing data, and therefore making the healthcare system more efficient, bring more convenience, more personalization, as I said, to the system. Yeah. That's kind of my point of view and angle I bring into this discussion, and now I hand over to Regula.
Thank you, Mario. So I'm Regula Spieler, COO of Hey Patient. Thanks for having me. Much pleasure to have you all here and exchange with you. Hey Patient was founded in October 2019 after I took our youngest son to the emergency department, and I found myself filling in some papers, getting my insurance card. And then we had to wait for radiology because the data was missing, and the journey went on. And I'm in awe of all healthcare staff members, what they do to keep all this up and give an amazing treatment instead. Although data is missing here and there, and they have to cover up for that. And the story that really hit me was at the end, next day after the operation of our son, when the doctor with red eyes, totally tired, he told me how the operation went, what was well, what we can experience at home, what we have to take home, which medication he has, what the nurse will do, what we have to take the teacher and also the sports trainer. And at the end, when he went out, the nurse asked me, do we now have to change this one again? And I thought, well, this was just a broken arm, but what happens if there is a more serious treatment? And my background is business economics and process organization, master in MIS IT. And from my perspective, I just saw, in 2019, we didn't have this lack of personnel, but now it's even worse. And I think, at least from the process point of view, we can help. We can do something that data is here. And that's what Hey Patient does. We automate patient-faced processes to reduce administration, and this is a real business case for hospitals, which are our main customers. And this is also going into the topic of data interoperability, because we are more on the case where data starts to be gathered, data exists, and also where we want to inform patients on the data, hand it over to them, and also data regarding the best treatment that comes after this appointment and all these things. And there, when we started with Hey Patient, we did go to the street, talk with people, talk with hospitals, and we met people with folders full of papers just to be sure that they don't get lost. And this we wanna help on both sides, so patients and healthcare providers, to simplify healthcare. So we are in the midst of the topic.
Fantastic. Thanks. Great panel, isn't it? So we'll spend the next 20 or so minutes going briefly through three kind of buckets of topics. One around kind of health outcomes. How much do we actually know, or how much does a doctor know about a patient in front of them? The second one, a little bit about operating data and what especially providers and insurances have to work with and where we can improve in the system. And then as well, at the end, what kind of data is available for public health and research, potentially anonymized, and how can we accelerate developing new insights? After that, we'll bring Clayton back on stage and open up for Q&A. Again, we will have questions in the room. We'll have questions from the audience online. I see the first two here. Kudos to whoever already submitted some. Please ask questions here, and we will try to get to as many as we can. So coming back to what does a doctor know about a patient today? And Regula, you just mentioned it, right? For your son, it was precisely little and data were missing. Can you sketch a little bit further kind of where do you see the key issues right now? Where data are sitting, how they're being transmitted, what the situation is at the moment?
Mm-hmm. So from my point of view, I mean, there is a historic reason why it's that like it is today. We have data silos, so data in this system, data in that system, and data in that system. And sometimes hospitals or healthcare providers manage to bring these data together, but even when they bring it together, it may not have the same format. So I can go into depth for example, an appointment is not called the same in that system like in that system, and then you manage the data together. So it's really the problem of the same format, the same terminology internally in a hospital to the other hospital. So the challenges are endless. And then also hospital staff is not reimbursed to bring this data together. It's in their own interest, but they have to carefully consider, especially at the moment, where do they invest their money and what can they do and what is the biggest value for them. So I understand the challenges, but that's why we're here, we try to solve them. But that's one part of the story, yeah.
Yeah. Mario, you're working in that space as well, right? Trying to create efficiencies in the system.
Yeah. We kind of have the same challenges, I guess. So we provide access, as I said, in the healthcare system. So one thing is really about the interoperability and standardization, because you have different players, different systems. Already in my small ecosystem, it's just the 6 investor and major players. It's really already hard to bring it together, and then you open up the system and want to create a really open system. That's the tricky part, and I think therefore it needs standards. It needs kind of a point of view. That's one thing. The other thing, I guess, what is also important to have the right to bring people to share the data and to access this. Do they know where to share? Because there is Hey Patient, there is Well, there are lots of other applications by hospitals, by other players, and you don't want to share the data. You want to share it once from a user perspective, and then say, now I have to go to the hospital after, 10 years, and then I want to upload it to Hey Patient, and you don't want to do it. You want to share it and connect it, and this interconnection, this is really the trouble in the Swiss healthcare system, I would say.
Yeah. Absolutely right. You only want to upload your data once, but even if you had this opportunity, you still need someone to actually look at the data. Right? Exactly. So how do we think about who will actually do this? Who will have the time and resources to then look at these data that may come from different sources?
Well, what we do is we take the patient into the process. So we enable hospitals to design process that they can, for example, send questionnaires even before a patient enters the hospital, that they can have a digital connection and really have a journey and the digital interaction with patients. But on the other hand, if there is not an appointment and somebody just wants to let the hospital know that they have an allergy, it's not every hospital that can do that, because, again, the systems are different and they have to bring the data together. So it really depends on the level of digitization readiness that this data can be transactioned. And hand over to you.
Yes, it's a technology question,
but also the process-related view and the awareness, and that's why we talk about it, so that this readiness, also from an awareness point of view, increases, like this fertile soil that was mentioned by Clayton. Exactly, that's what we need.
Anna, how do we accelerate creating this fertile soil, right?
That's a
From
very
a standards to an incentives perspective.
No, I'll have to bringing the ball to my court, right? I think we operate, and I mean the healthcare organizations that we serve at AWS operate in a highly regulated industry. Yeah. So there is a questioning there on what is the role of laws and regulations for all this change that we are aiming to have. There is a question of a regulation that puts innovation at the center, together with the patient or the citizen, of course, but what is it that we want to serve this patient with? Cloud is really providing things that you could not achieve, like using on-prem. And taking the fact that there's also scary data, 13% of health organizations have a data strategy that they really follow. Only 13% follow the implementation. Distribute, like the task and really go back and revisit. This is not just a document, like a strategy that you put in a drawer. Yep. It's, again, something that is live, and it's really used by people every day. From our perspective, the way we're supporting customers to do that is really the discussions on health data spaces. As Clayton referred to the data ecosystem, we see like the EU side, they're discussing an European health data space, even a regulation that is going to bring more legal certainty. So I think those operating in this field, they really need legal certainty and clear requirements. You're going to innovate, you're going to change things. It will have some level of risk, but how can you mitigate that? So having like a plan for your cybersecurity in the cloud. This is something that security is number one priority for cloud, right? And it really doing the working backwards from serving the customers is also talking about all these to patients and citizens to make sure that they're also asking the providers like, do I have access to my to the exams and all my clinical records? Is the patient also having access to all this? Yeah. Sometimes the patient will be like the main carrier of this information. In other systems, the patient would not be carrying this information. And this, of course, it varies from culture perspective, but also what is the goal of that health system and how they can, how they're able to use the technology that is there to achieve those goals.
Yeah, exactly. So I heard an example that doctors sometimes only trust these still PDFs or faxes that are being sent because they want the stamp, they want the signature to saying the information in this letter is actually certified and is true, versus trusting a data upload or trusting data that are transmitted electronically. So, and there was actually a question from the audience here as well saying, how do we create trust here, right? How do we make sure that a doctor trusts the data? And you alluded to this just now a little bit, how do we make sure the patient trusts kind of that the data are shared responsibly? What else can we do to make sure that all the actors in the system will trust it and will take the data at face value?
I would say trust is on one hand, it's about access, identity and access management, and the security set up for the whole. And when you have certification, standardization, as we said, you can create trust.
Yes.
On the other hand, I see it in our ecosystem with major players from the Swiss healthcare industry that contribute and invest in your platform. That creates trust too. And actually they bring the customers or the app users to our application because they have a long-standing health insurance relationship and say, well, that's something good. So there's also a kind of a relationship component besides the security component about creating trust.
Yeah.
And third, I think it would be the public policy makers, the lawmakers that can create trusts by setting kind of a framework, a standard, international or national standard that helps to enable this.
Yeah. You had a direct.
I can maybe add to this. I mean, what on one hand, we can use what's already there, like HinMail or Swiss ID and these things.
Yeah.
And on the other hand, it's also speaking of patients' trust or citizens' trust, we can have a citizen-centered architecture maybe, so that it starts with the citizen that gives access to a healthcare provider or just has the possibility to hand in a digital application so that the admission form is oblivion. And then the design of the solution must be that you intuitively understand where you are, who you share your data with, and all these things. And I guess that's also a very critical point, because if it's complicated, then you start thinking about it, what am I doing here? And I guess it must all come together, and that's also kind of a challenge. So it must be easy, it must be user-centric, it must be nicely designed, and it must be super safe. Like we would maybe have it in banking sometimes, so I guess it's possible, but it's not well known in healthcare.
Yeah.
And I think it's worth asking the question of who is going to raise the wrong questions in the room sometimes. For example, in hospitals, we have one example of a customer in Germany, Manschleife Hospital, who is now 100% in cloud, right? So decided to shut down local data center and do everything in the cloud. And a few years ago, if you think about that, it would have been more challenging for them to do that. So the way they did the journey considered pretty much the highest level of cybersecurity. And there are specific certifications for hosting health data, multiple types of health data, right? Because there are different levels of categories of health data. That is data that's going to go into genomics and your DNA, and there is data that is going to affect, for example, the lining for services, or sending an SMS is going to reduce, for example, the level of no-show for exams and checkups. So this is the type of data is not monolithic. There is a paper from the WHO and WTO at the WIPO talking about data is not a monolithic thing, and we should take that also in consideration. But the certifications are for sure, I think, another level of making sure that government is putting in place, and the agencies that are in charge of security are putting in place the highest level of certifications for those dealing with health data. Yeah. It helps provide trust for the organizations that are going to experiment with the many tools that there are there, and also to the patients that are going to be, in the end of the day, those seeing the results, right? Because if I am able to see 15 years of medical record of myself, and this will help my physician give me a diagnosis of a disease that I may have. Of course, if I see the results of that real time, real life, that's a way for me to trust things because it's delivering me the care that I need.
Fabulous range of responses. I also love how in this discussion we already touched on kind of the experience of users of these tools and making sure that people are able to kind of use them intuitively and quickly, and it doesn't add to the burden, right? Healthcare workers are typically overworked. Patients are under duress, especially in situations where your kid is sick or so. So you can't have tools that are super complicated and super complex. So I love that this already came up. To conclude maybe this topic, we do have a strong innovation ecosystem in Basel, and Day One is supporting this. Maybe some advice for innovators in the space. What would you say? There's so much innovative potential, like we said, based on data and analytics and digital tools and apps and so on. What should innovators think about as they try to design ideas or find ideas that can be scaled to make the situation better?
Well, I would really look out for the exchange. Don't hold your idea back too long. That's what often happens with startups. Go exchange. We started with a clickable prototype. We went to the streets, talked with patients. We went to hospitals, talked with them, because then you also hear feedback on, is there really a business case? Is there really somebody who's going to finance? Everybody will love the solution, but is there really somebody who is interested in funding this? Or is there a business case that you have your first customer already? And if yes, then ask them what they really need to get the maximum value out of it. So don't hold the idea back, exchange, and also maybe exchange with competitors in the field or with whoever, but speed it up like this.
Mm-hmm. Yeah, I fully agree on that. So for me, on one hand, it's about client centricity, customer centricity, involve the clients in the development, get regular feedback, small feedback loops in a agile way. So that's important to create value for the customer, of course. Second, in an ecosystem like ours, it's also important to create value for our partners. The health insurance companies are my major partners. They pay for 85% of our business model for the application, for the personalization or customization of the app. They get a dashboard with aggregated data they would not access otherwise, and so on. So they really we create value for them, and that's important. You have to keep in mind who are you creating value for in a business to customer. And of course, it's also about our own business case. So how do we create value for our ecosystem? How can we survive? How can we remain cost efficient and be break even after 3 or 4 years? So I think that's the hard one at the beginning: the customer, the partner value, and your own company value.
Yeah.
Yeah, I think these are very good. I agree with you. I just think that maybe it's worth asking the question, what's holding you back? It's very nice to share all the success and the positive side of the stories, but what is it that is holding you back in your startup or in your role as an innovator in a public hospital or in a clinic where you work, like in radiology center? What is it that you would like to do and you feel you cannot? And normally what we're doing at AWS is contributing to, as I mentioned in the beginning here of my introduction, translating these issues into something that is clear in the mind of those that are making the regulations and the legislation. Sometimes this is very far from the reality, right? They're dealing with different issues and they are not cannot be experts in everything. Different from life sciences regulations. So they are the regulators in life sciences, they are the experts, but sometimes we also bring this reality to them and ask for their views and open dialogue. I think in the spirit of building a broader network of collaboration, back to Clayton's keynote, there's a role for private sector, but there's a role as well, an important one, for citizens and patients. We at AWS, we sat with a team of interviewers from the European Institute for Innovation through Health Data and a consultancy called the Health Policy Partnership. And they came up with a paper about cloud. The study is called Our Health in the Cloud. This is not a promotional piece from AWS. It's just a very fair, and it's a paper putting exactly what we're talking about here. Examples in real life, from reducing time to diagnosis, reducing time to a step in precision medicine that is going to affect your decision if you go for chemo, radiation or not. It's about accelerating these steps. It's about making this more affordable for more patients. And it's about putting innovation at the center and making sure that we are having this dialogue as a multi-stakeholder group, I would say.
Yes. And not to overcomplicate this, but the more we think about kind of switching from sick care to health care and enabling healthy longevity and looking at prevention of diseases, you need to set incentives such that that patients and caregivers and physicians actually emphasize what you can do to not, get sick in the first place. And I think what you just discussed in terms of business models and align incentives, we won't solve this in the next 5 minutes, but that is a fundamental challenge, right? You need to invest today to collect the right data and have information to prevent disease, but the benefits come years later and maybe for other stakeholders. And so maybe at the apéro, this might be a nice topic. If any group here can solve this, I would be happy to hear about it. To switch gears, we have about 5 minutes, and then Clayton will come back and we open for Q&A, both online, and I get more questions here as well as here in the room. We talked briefly about operational data and kind of the efficiency possibilities that are in new technologies and using data, right? We talked a lot now about how do you measure outcomes, how do you bring the data together. But maybe let's go through the panel one time to just saying what opportunities do we see, and I know both of your companies as well as AWS are leveraging these opportunities, but it's great to get your learnings in terms of what data do we use to then make the healthcare system as it exists today more efficient.
So,
Margula, do you want to start? Yes.
Well, I can tell out of our own customers' business cases, admission of patients can be automated by 98%. check-in, navigation of patients, preparation, and I always also include the personal care network, the Hey Family, who can support patients. If we have the discussion, is the typical hospital customer even able to use an app? Yes, they are, and most support calls we get is from older persons who take care, and they want to get to know the app, and they really appreciate it. So we can automate all these patient-faced processes, and that's how we can also set the hospital staff free to really take care of the patients, which we all want. And then I hand over to the care.
Care system
Yeah.
or integrated care system. Yeah, for me it's a little bit different. So on one hand, it's not just about personal health information, not just about health data. The start when entering the Well ecosystem is about, as I said, about sharing data for personalization matter, insurance, card number, or its family mode, as I said, or other preferences that help to customize the app. So that's not personal health data, but it may help you to get the right access point within the system. Yeah, and this is also really important because we have many people from around the world here in Basel, expat and so on. They don't know the system really well. So it's also valuable to share this data and information to get the right access point. And then the more tricky part, of course, besides the personal health record and the documents, I would say even, we have as data, in my point of view, it should be added by a kind of a health dashboard with structured data that really helps you to make your health better or to stay healthy for a longer period. And there I think structured data and along the path and the exchange with doctors or other medical experts, there it is really harder to get in depth of the processes. But there are different type of data, of course, that are interesting. Yeah. And in the first part, it's more the low-hanging fruits. Yeah.
Yeah, I would say I think a legal framework that works both nationally, but also is looking into the world that health data will flow. Yeah. The patient will not necessarily be traveling cross-border, but maybe they will. Yep. And maybe this data is going to be useful for research and development, and this is something that we normally look at. We cannot just look at it as from a purely national perspective, although there is also value in that. It's a cross-border collaboration, and the role of policies for this data to flow at the same time. I think the requirements around the governance of this data is important. So a legal framework, governance, who is doing what. A few countries may decide that they will have like national health data protection authorities, and this is one area that a few countries are going in Europe. Other countries may decide that this is not necessary. We already have a strong legal system in place. It's about making sure that there is quality of all this data that is being collected. So those collected will have to find ways to grant licenses or find ways to share it with those that are innovating. Yeah. And it's about the architecture, right? So is it going to be like a federated model? You will decide if it's going to be a data lake or if it's going to be a data mesh. So going to more the technological steps. But I do think that what we are seeing from where we see it is that customers are aware that they have all these tools. Everyone is looking already into the artificial intelligence and machine learning. And if you don't have structured data, if you don't have quality data, it's very hard for you to consider even your AI ML strategy if you're still in the early days of your journey. So that would be my 2 cents.
Very true, yes. You very well sketched the challenges from the technology, the data, the players, and even like the international component. Let's bring Clayton back on stage and open the Q&A. I think we'll take the first question from the room and then go take turns between room and online. We need to scooch together a little bit.
Yeah. Here? Yeah.
Okay, everybody has questions in mind here in the room? Thank you so much. If not, we'll go online.
Ah.
Okay, you decide. Ladies first. Anne, hang on. Mic is coming.
This is Anne Ulvestad. Thank you very much for a very good panel discussion. So health data is very important topic and close to my heart. I believe that as a citizen, I should have access to all my health data. And I think it's terrible, the state that we are in Switzerland with how fragmented the data of health is made available or not made available to us. And I also think that we believe that we need to look beyond Switzerland and other countries where they have done it better. So I am from Norway, and I think the Scandinavian countries, I think Estonia is a good example of a country where they are much further in the digitalization.
Yeah.
So, and then on another point, I think the innovation...
Yes, maybe take one point at a time,
Yep.
if that's all right. So access to data and access to individuals' own information. Who has thoughts? Who wants to start?
Is there a question? How we can enable that, or
Do we? Yes, exactly.
yeah?
Do we
I
agree? How
mean,
do we enable
that's what we do. I mean, with a patient, you can on purpose, you can say, I want to share my data with this hospital, but the reality is the reality we have. That's what we are now in Switzerland, slowly but surely introducing the electronic patient record, and everyone is asked to put all the documents therein. At the beginning it will be PDFs, but that's what we start with. We are going towards structured data somewhere in the future, and yes, it would be nice we would have the state of Norway or Estonia already, but we try to do what we can.
Yeah, in the end, I think too, it's what we try to do with our ecosystem, to connect the dots within the system to other platforms, to other players, to all the actors. But it's a step-by-step approach. As you can imagine, to create a Swiss healthcare platform, you have to start somewhere. And as I said before, where can you create the most value for the customer, for the user? Where can you create value for the partners involved who finance you? How can you start to establish the system? So it takes time. It took us now 2 years to bring 200,000 users to the platform, but we keep going, and it would be exciting probably to talk to you afterwards to get more insights. But we need people and we need partners that innovate and try out all the applications and opportunities we have.
And yes, I guess applications must be embedded into platform. I mean, we also built one. We have various partnerships with other platforms, and this is really important. Otherwise, we don't bring these data points together. But it's also an integration for the players who integrate themselves into the platform. So it's a bit egg and chicken problem, and we are starting with it. And
I think it's co-creation.
Yeah.
So collaboration and co-creation is key. You get out more of your data if you share it. And that's I'm not gonna as Regula said, hey patient is way further with the hospital journey and their application and their platform. So I don't have to reinvent that as well, but we talk to each other. How can we get use cases to bring this together to Swiss citizens? That's how it should work, and not to create new stuff in silos, I would say.
I think it's a great question that indicates how much we need to look across the ecosystem and beyond our own borders, right? There's great examples, like you said, in Estonia or in the US, the Blue Button Initiative, where every organization has to have a blue button where you can download your data. There are examples out there. I think we all need to learn from each other to innovate. So thanks for the question. Question online. Patients can collect a lot of data today. You can get your genome sequence, you can use tracker data, and so on. What do you reckon right now is the impact on the healthcare systems of being able to collect these data and using them? We touched on it briefly before, but I think kind of saying where is that now and where could this go is an interesting follow-up. Where are we today on this?
Probably.
Yes.
You go first.
Clayton, you go first.
Where are we with this? When I speak to patients about this, I think they feel that they're enlightened by the fact that they can come with their device data and in some cases, in some countries, actually have that data uploaded to their own personal health record. They feel that that gives them a certain sense of autonomy. They feel that there's a hope that this will be registered and used by the healthcare professionals. When I speak to the healthcare professionals, and I have to be careful because I'm married to one, and we have dinner conversations around this thing, they hate this data. They hate it passionately because for them, it's noise. It doesn't add value to their diagnosis and to their treatment of the individual. So we have somehow a disconnect here.
Yep.
And again, we need to ask ourselves, if we're collecting data, then it has to have a value for someone. And who is that person that we're expecting to have the value? And why is it not the clinician? In my I wear one, and I hope that the data that's collected can either inform me, which is also a valid person to receive that information, but I also maybe need not to have the expectation that my doctor is sitting there watching every time my heartbeat gets over 83 beats per minute. I wonder what he's doing now. So there is, I think we're in a process of transition into how we understand how user-generated data can be utilized effectively for clinical care, but even more so for preventative health.
Yep. Anything to add from your perspective?
And for patient engagement.
And for patient
empowerment. But
absolutely.
yes, we are in an awareness phase, and we are still building the soil.
Yeah, I think that's and population health, right? Like in the end, when we're able to collect this amount of data and anonymize it and decrypt it, part of the uses or the secondary uses of health data is to do good public policies and take good decisions, right? And we experienced that with COVID. So I think it's also the use of this data, once anonymized or collected with consent, it's also to inform good policies and decisions.
Yeah. And maybe just to add to this, on the kind of research population health perspective, I think research projects, whether it's a clinical trial or a cohort study or so, gives us a lot of opportunities to use a lot of these tools today already and integrate it into the data collection, and hopefully collect like evidence and insights on how do you make best use of these data and then inform how we bring this into a healthcare system. So yes, we're on the cusp and ready to use it. I think Nick had a question in the room simultaneous with Anne.
And that disconnect, I think, was one of the things it's come up a lot, right? The difference between, on the ground healthcare providers and then what is this data valuable for. So we've talked, these conversations are so complex, right? And they go all over the place. So we talked a lot about potential value that could happen, a lot of challenges for realizing this, the principles we need to adopt and solutions. So I think my thought was just, could you simplify things and say, at the end of 2024, and let's say in Europe, what one critical thing would you request to have happen or wish to have happened, and why? Where do you think the investment should come from if necessary, and who should take the lead on doing this?
Great question.
Good question.
Yeah, I would suggest that if we could change one thing, It should be that system interfaces must be open for everyone and that we have common standards. I don't even say one standard, that would be excellent, but at least a few standards so that if startups develop something, they can bring it to use and not simple single players have to invest heavily to make it happen. That would be one thing that would give a great boost, I think.
And who should drive that?
Takers?
Well, I guess it would have to be political, otherwise nothing happens.
Okay, thanks for the question. One more question from the internet or from our online audience in terms of not overwhelming participants in the healthcare system, HCP as doctors, kind of being able to interface with a lot of data. What can we do to make sure that healthcare workers and patients are not overwhelmed with the amount of information and options that they have at their disposal? We talked about kind of if you have 15 different apps and upload your data in many different solutions, how do we prevent this? Like, how do we keep this easy and not add to the burden?
I think it's the involvement in the process. So go forward in small steps, small use cases, and involve the relevant stakeholder. It's as simple as that, I would say.
Yes, except for you have many stakeholders to involve. So.
Yep.
Yeah, I mean, if data is easily interoperable, then we can just put the data into the system they work with anyway.
Yeah.
So that would be so simple. They use this system. They look every day, every minute. They look at these systems. They are also mobile now in their hand. So if they see there all the data patients would like to make available to them, that would be so much easier. But if we have to fight for every field because data is not open and not interoperable, then it's difficult.
Yeah.
And the same on the patient side. I mean, if it just goes through various platforms and you don't have to care which, you just use the app you like most.
Yeah.
Mm-hmm. And therefore, often it's easier to start in a closed system. You have one hospital, 10 doctors, one pharmacy, and so on. And then it's easier, and then scale up when it works. Because when you start with whole Switzerland and 78 system and so on, it's
huge fan of Agile, right? Have a prototype, an MVP, show that it works, and then
very classic.
You were talking about.
Yeah, I want to actually, if I could, I want to respectfully disagree. So, healthcare workers are really being pushed over the edge to a point where in WHO, the projections for the number of healthcare professionals we won't have by 2030 is alarming. I'm personally really conscious and cognizant of the fact that data, the process, the onus on a clinician to gather data for the treatment of a patient every second detracts from their face-to-face time with the patient. And I know they feel that in their hearts, and the thought of us producing systems that further create burden on them, I think, is a terrible one.
True.
Part of the root cause of this, and I feel quite strongly about this, is that in the majority of cases, what we took when we digitized health was we took poor paper processes and we made poor digital paper processes, essentially digital process. So what we're living with today is a lot of legacy systems that don't connect. And I see doctors, unfortunately, signing onto different systems, 6 or 7 or 8, just to treat one patient. It really is a burden. So I think what we need to do is we need to re-engineer the processes to the point where we have minimalist data sets and minimalist clicks, literally clicks, for them to actually do this. Now, I've seen some innovative solutions, which I think are quite interesting, involving AI that actually have listening devices in primary care. And these listening devices simply record the conversation under consent of the individual and the clinician. And they're smart enough now that they can actually summarize the core elements of what was discussed without all of the noise and actually put it straight into the journal without the clinician having to type anything. And I know hospitals like Karolinska and others are actually really seeking to look at how they can employ these types of technologies that completely remove the burden from the clinician, such that they can then spend more time with the patient. I think they're the types of solutions that we need to focus on and really laser focus on how can we make the life of a healthcare professional even 1% better than it is now.
Very, very good. Unfortunately, we're out of time already. Yeah, I know, such a lively discussion. We'll all be around for the next a few minutes or a couple of hours, depending on who, to continue the conversation. And looking forward to discussing further. Many thanks to the panel for insightful discussion and your contributions.
Thanks for having us.
Brief summary. I would say we touched on a lot of different points, and I know we didn't solve many of those. But I think some of the key takeaways from me were there is a lot of opportunity in leveraging technology solutions. We have healthcare systems which currently are legacy healthcare systems. They were built for a certain type of process, and with these new tools and new challenges today in terms of really shifting from sick care to healthcare, the systems aren't designed to cope with this, and we really need to rethink how do we not turn digitize processes by just turning it from paper to digital, but rethinking how we deliver not just care, but also how do we deliver health. And how do we make sure that all the participants in that system, whether that's stakeholders at the global, regional, local level, but as well the individuals that are actually part of this process, whether that's the citizen of the past, or the citizen or the patient of the past, whether that's the doctor, the caregiver, or others involved in the process, and really design systems that make life easier for everybody, but making best use of these technologies and these data. So with that, I'll hand it back to Rahel and Anka.
Thank you so
Thanks,
much,
everybody.
Peter, Anna, Mario, Regula, and Clayton for this interesting discussion. It's great to see that things are moving forward, not just on our European and global level, but also in Switzerland, thanks to initiatives like Well and the Hey Patient and all the other initiatives in Switzerland, of course. Happy about that. With this, I'd like to conclude the event. Thank you again for being here. Thanks to the audience for being here tonight and asking your questions. Please join us for the apéro. The speakers will stay with us and surely would love to answer more questions. We'd like to thank also on behalf of Day One, Novartis for sponsoring this amazing place. I love to be here. I also always love the apéro that we can enjoy here. We will have an upcoming event on the 4th of December, the last one this year on generative AI in healthcare together with Sülke. So note it down, promotion will start soon. And I'm looking forward to see many of you here again. As always, if you have a digital health or health tech startup or you know anyone who's looking for office space, we're always happy to add more startups to our community at the Switzerland Innovation Park. Yes, but with that, happy to invite you over to the apéro. Thanks again for being here.